Welcome to EO Talks, Eastern Oregon's very own talk show, only here on EO Alive.
Hey, Eastern Oregon, thank you for joining us today on this episode of EO Talks. And today, this is another continuation of our MAP program that is brought to us by CHD. And I'm joined today with Corey Escobar and Aaron Griggs. And Corey, you're new to this session today. Why don't you introduce yourself to us and tell us your role?
Yeah, my name is Corey Escobar. I've been at CHD for, I think, a little over 4 years now. And my role for CHD is I am a project coordinator for some grants and some programs that we have at the behavioral health team.
All right. And Aaron, refresh us on what it is that you do.
I'm Aaron Griggs, Mental Health Director for the Center for Human Development here in Union County.
All righty. Well, thank you. So today we're going to talk about, I tell you what, guys, I just got to make sure that our audio is working here. Sorry for the awkwardness here. Just want to make sure.
We'll just smile awkwardly and let you do your thing.
It's working here. Okay, it is. That's good. All right. So let's see. I'm going to. All right. So today we're here talking with you guys about the housing program that is associated with the medication assisted treatment program, which is specifically for folks who might be struggling with opioid addiction, whether that be through they took some painkillers after an operation and became addicted, or they have been on heroin and they're trying to change their life and get off of that. And we've I think this is the third or fourth session, and we're talking about the ways that the program can help people kind of do a step-by-step approach. And so today we're talking about housing and how that fits into that. So, Corey, why don't you start? Kind of tell us how critical housing is to someone who is in that situation and how this program assists them.
Absolutely. There are a lot of things that need to come together for someone to kind of become recovered from an opioid use disorder. And when you don't have stable housing, it's in my opinion, the housing part is one of the most critical pieces that you need. It's kind of the first step toward recovery. So this housing assistance program helps the individuals that are diagnosed with an opioid use disorder, and it assists them kind of through the housing process and gets them into some stable housing of their choice so that they can kind of take that first step into the, completing treatment.
I think we can't hear you, Brent.
I think you might be muted there, Brent.
So talk to us about the complications of why housing can complicate someone's recovery. I don't know, maybe give me an example of someone you've known or seen. I don't know. Talk to us about that.
Yeah. So the vast majority of times when an individual is, diagnosed with opioid use, they often have frequent involvement with law enforcement, with they might be in and out of jail constantly. It's really difficult to start into that recovery process when you're constantly being picked up. And it's kind of a vicious cycle in a way. So, reaching out to these individuals and starting that process and getting them the housing that they need, because it's very, very hard to focus on recovery and treatment when your basic needs like housing, shelter, food are not being met. So that's what this program, as housing assistance, is kind of trying to tackle, is that problem of the lack of housing.
So someone is involved in illegal drugs, they get picked up, and so once they're out, maybe the only place they have to go is the environment that they've been living in, which maybe contributes to the addiction that they're having. And so they're stuck in this cycle. So Aaron, talk to us about a little bit about the bigger picture and how this is a component of the entire program. Because some people will be like, well, why do we need to be responsible for helping with somebody who's addicted to drugs, housing, and why are we doing this? And so maybe talk about the bigger picture of what the MAT program does and how this fits in.
Well, as we've talked about, Brent, that people start using opioids for various reasons. It could be because of a prescription they had from their physician. And they may have become even dependent on the opioids. And so getting off the opioids is really difficult. Sometimes they get cut off from their opioids, and so they start transferring that to other substances. Regardless of whether or not it's an illegal substance, having that addiction can really cause a lot of challenges, and can cause a lot of challenges health-wise as well. And so through this treatment, they can get on Suboxone, which helps them be able to reduce those symptoms that are associated with detox, eliminate them, and then be able to do their treatment, get their counseling, get support from a mentor, go to their 12-step groups, wherever it may be. So a lot of people have run into a lot of challenges, and they end up in really difficult situations, and they end up in this horrible cycle like Corey's talking about, and they start couch surfing or not having good, stable housing. And so being able to provide that housing assistance temporarily to where they can get back on their feet, get that Suboxone on a regular basis, start getting treatment, and then be able to get out and get their own place, get employment, and then they can start becoming a contributing part of our community again. There's actually a related program that we have for individuals who have frequent contact with law enforcement, where we are not only focusing on that addiction treatment and getting the Suboxone, we're also focusing on kind of healthcare navigation, making sure that they get to their healthcare appointments, that they get signed up for health insurance. Somebody, when you actually end up going to jail, you lose your health insurance. Now, I want to make something clear too. Not everybody who has an addiction or a substance use issue is involved with law enforcement, and we're not saying that at all. But for those that do, it's a real challenge to get out of that cycle. And we've got some great individuals in our community who have been able to get past that and have had past involvement with law enforcement, and now they're able to contribute to our community quite well. And so we want to be able to give everybody that opportunity. And housing is a basic need, so we want to make sure that they have it. So this other program I was talking about, called Impacts, helps individuals who have often been having contact with law enforcement because of substance use or because of mental health. So this actually goes beyond the substance use, so that we can make sure that they get to their health care needs, they get additional housing needs taken care of, and then we assist them with employment as well. So there's that aspect of it. But that's kind of a separate program than this housing program. But that is in addition to this, and we want to make sure and address all those issues in this community. So.
We've talked before we've used the word holistic, and how then that the MAT program really, you hope is kind of a one-stop for folks, and the gate is pretty wide. It's for those that maybe are recovering from opioid pill use, or they found themselves addicted to opioid pills, and then those that maybe are involved in heroin. And so there's kind of a wide approach for both of those. And the housing complications probably are more, like you've mentioned, they're more related to those folks that have had interaction often with law enforcement in one way or another. So are you guys working with the local law enforcement agencies? And talk to me about that.
Yeah, actually, we've been doing a lot more coordination with them. I can tell you historically, Center for Human Development has done a lot of close coordination with both LeGrand PD and the Sheriff's Department, especially when it comes to people going into a mental health crisis. We have a mobile crisis team that coordinates very closely with them, responds in the community wherever that individual may be, whether it be at the school, at their home in the community, other community agencies, or at the emergency department at the hospital. That mobile crisis team works closely with law enforcement to make sure that those needs are addressed. Recently, though, we've been really having some significant discussions with both Chief Bell and Sheriff Bowen about the increased calls related to behavioral health. And I say behavioral health because that usually includes both substance use disorder and mental health. And so we're now collecting some of that data to better understand how many more calls they're getting and where those are coming from. And then looking at those individuals who are having frequent contact, maybe the families are calling frequently and concerned about them, or those individuals are actually calling themselves, and seeing and then doing some specific outreach to those individuals in the community so we can prevent them from having additional challenges in the future. And that outreach can take a while. You know, sometimes there's people that just aren't willing to participate in treatment, but we've also found that if we continue to reach out to them, even over a longer period of time, sometimes those individuals often will come around and decide that it's time for them to get treatment. And we want to make sure that that's available to them. So we do that outreach. But we're very cognizant about the increased needs in our community. And so we are trying to figure out ways to increase our capacity to respond together with law enforcement. And a big part of that is just making sure that we get good data from them and good information so that we can get out there and address those needs in the community. So, you know, we are really grateful for the wonderful law enforcement we have in this community. And I will add too, it goes beyond that too. We work closely with community corrections, that's local parole and probation, also the courts, the DA's office, defense attorneys in the community. We're really trying to develop those solid relationships so that we can prevent future challenges in these individuals. And we're identifying those individuals early on so that they have access to that treatment. And housing is one of the potential benefits from participating in treatment.
So talk a little bit. Clearly, someone has an interaction with law enforcement. How else are you becoming aware, or are they becoming aware of the program and entering into it?
So a lot of ways. We work closely with also the emergency department in the hospital, Grand Ronde Hospital, Regional Medical Clinic, the LeGrand Family Medicine, also our other community partners like Juvenile Correction, DHS, Community Connections, Neon, Shelter from the Storm. We have various coordination meetings in the community where we're connecting with these other organizations and making sure that they're fully aware of the services that are available. And they refer people on a regular basis over to get the myriad of services that we have. Also, we've got a large media campaign. This is, part of it. Trying to get information out. Some of you may have seen our new billboard that we have out on Island City Avenue, talking about, if someone in your family has been impacted by addiction, either yourself or maybe your addiction has impacted somebody else, and with an invitation to give us a call, so that people can get services. We also have our crisis and access line, that if somebody is feeling like they're having thoughts of suicide or not wanting to live, or they're just feeling like, life is hopeless, we want them to give us a call. And that's our 541-962-8800 number. When we encourage people to reach out to us. And we also have, Brent also put up on the screen there, that's our direct number to our medication for addiction treatment program. And that's our 562-HOPE number. So we have that one that's specifically for medication assisted treatment. That's opioid use disorder. And then we also have the 8800 number, and that one's for crisis and mental health outreach. So yeah, we're we want to make this available to everybody, and so we're trying to make sure that this information is readily available.
That's awesome. Anything you want to add to that, Corey? I mean, how has your experience been with that? And it's good to see you. I've known you for years, and you're good friends with my son Brady, and we'll have to tell him later. It's like, hey, you got to check out this interview. I interviewed Corey today. Yeah. So, yeah. How has it been for you to be a part of this, and what are you experiencing personally in helping people in this manner?
I have very much enjoyed kind of building up this impacts program kind of from the bottom up, and starting this entire thing here at CHD. It's been really nice to focus on some of the key aspects of this program. Like what Aaron said, we're focusing primarily on housing assistance. We're focusing on healthcare navigation, employment services, and then there's also that we're involved with crisis as well. So we have noticed that there is kind of a lack of kind of treatment services for individuals that have a mental health diagnosis or a substance use diagnosis that are constantly involved with the justice system. So that's what this program is kind of targeted for. We help in those categories. If you need assistance with the housing, we can work with you on that. We can help you get to your appointments that you need. We can also help you with your OHP application to renew it. And then also we have an amazing supported employment program, which I worked in before I took this new position, that helps individuals obtain and maintain gainful employment in the area. So these critical aspects are kind of making up, why we're doing this impacts, why we're getting this grant, why we're utilizing those services. So it's been a very nice, it's been really nice to work with Aaron directly on this. And, I really cannot wait. And I'm very excited to see, where we can take this.
It's kind of like you're doing everything you can as an organization to eliminate the excuses. So, and that's awesome. So it's like, well, I can't do this because, I don't have a place to live, or this is the thing. It sounds like you guys are really working at, helping people eliminate their excuses, helping them find ways of getting them in the program, keeping them in the program, and helping them succeed. And that's awesome. So, Aaron, how many people are involved in the MAT program altogether?
We have I think we have about 8 staff members that are involved. Client wise, we're getting new clients all the time. And it fluctuates a bit as well. And, we definitely have sufficient capacity to take on many, many more people. And we're really excited to be able to offer this to the community. One thing that we want to make sure that everybody understands is that we're here to help. What we found is that every situation is different. And when we think we've seen some really complicated situations, we find another one that's very, very complicated. Every individual is going to be different, and we're going to we're going to cater the needs to that individual. So we need to have a lot of tools in place, and one of those, of course, like we're talking about today, is housing. But of course, we've got other tools, and hopefully the rest of the series here will go into that. We're hoping next month that our medication provider will be on, Del McQueenie, and she'll be able to answer some questions more specific about even some of the science and the medication that goes into this treatment. When I learned about the program around medication-assisted treatment, I was a bit skeptical myself. This was a number of years ago. But the more I learned about it and understood addiction and how it affects people and how it really takes over their lives. And as an individual in addiction, we have to get to the point where we understand that it has become unmanageable, and we need to reach out and get assistance, and to find out that there's a medication that can actually help us get through it, specifically for opioid addiction, which is just completely all-encompassing of someone's life, is huge. And to think about that many people became dependent on opioids, not because of the medical profession, frankly. I mean, and I hope I'm not offending any physicians, but I mean, it's been litigated in court that it was prescribed. And so for us to have a medical intervention for something that came about from the medical profession is really important. And I think it says a lot to those clients too, that the medical profession is saying, hey, we're going to own this, we're going to take care of it, we're going to figure out a medical solution for this situation. And many people talk about Suboxone as being a miracle drug, and really it is, because of the number of people that it's been able to help get off of opioids. And when I worked in a residential treatment facility years ago, and seeing people come in that have significant issues or trying to get off of opioids without the medication assistance, it was very difficult to ever see anybody. It wasn't impossible, but it was difficult to see people actually get recovery without the assistance of a medication. So we're really excited about this, and hopeful that we'll make a big impact here in the community.
Excellent. Well, thank you guys for doing this, and thank you for the discussion. And I can see how this would contribute. And there's the overall picture is that, and we hear a lot about this. And again, I hear a lot of my son-in-law is a sheriff deputy, and so I know, and he worked in the jail before that. And so I know that there's a lot of people that are caught in that cycle of being addicted to drugs, and they're in and out of trouble with law enforcement all the time. And so I guess, I'm excited that something is happening that's different than kind of what's been happening. So all righty. Well, any last words before we take off?
Just give us a call if you know somebody that's struggling with opioid use. Give us a call at 562-HOPE.
Yep.
I think I said that right.
Yep.
And then also, if anybody that's having a crisis around mental health, having thoughts of suicide, have them call our other number, 962-8800, and that's our crisis line here in the community for all of Union County. So thank you.
All righty. Well, thank you, Corey. Good to see you. And
good to see you too, Brent. Thank you.
Yeah, and thank you, Aaron.
Yeah, thanks, Brent.
Yeah, appreciate it. And we'll see you next time, Eastern Oregon, right here